Okay, Dr. Julia Raifman, welcome. The floor is now yours.
Thank you so much. Thank you everyone for being here. Thank you for that very kind introduction. I would actually love to learn who you all are. So if you want to drop in the chat where you're coming from and if you have any specific policy interests that you'd like me to touch on today, so you could just do that over in the chat. And I'll introduce myself. I'm Julia Raifman. I'm an assistant professor at the Boston University School of Public Health, where I conduct research on how health and social policies drive population health and health inequities. During the COVID pandemic, we knew that this kind of research was important to conduct at a rapid pace to inform the response to both the pandemic itself and to the economic crisis. So that led us to create the COVID-19 US State Policy Database, which is a labor of love, really led by myself, several data managers who've championed the work, and 30 students who volunteered to do whatever they could to help overnight when the pandemic first started. So I'm really excited to share it with you. I think the database is largely inspired by a decade of research on the Great Recession that helped inform a lot of the successes of the policy response to the COVID-19 pandemic. And what I hope is that we have a decade of research to conduct on policies to understand what happened, why, and how that can inform our responses to disasters of all kinds going forward. Okay, so I'm just taking a look at the chat to see. Great to see people coming from so many places. Okay, so this will be a presentation about the COVID-19 US State Policy Database, or known as CUSP, which is designed to inform COVID-19 prevention policies and policies to prevent economic precarity. The premise of our work is that COVID brought joint health and economic disasters. In a context of structural racism and structural inequities in the United States, disasters make disparities worse. Policy actions during disasters can reduce or exacerbate disparities, and federal leadership is key. Only the federal government has the communications capacity due to the pulpit of the presidency and the federal government, the coordinating and convening capacity, and the financing capacity, because the federal government can take out loans to be able to lead a comprehensive response. We see that this is true with COVID prevention policies in two administrations. We see this is true with vaccine priorities and delivery, and that it was also true with economic policy response and policies such as the stimulus payments and expanding unemployment insurance. Disasters can be an opportunity to change structural inequities or inform them in the future. So it can cause us to rethink policies like unemployment insurance, minimum wage, and paid sick leave. All of these policies have always been important to people, but during the COVID-19 pandemic, we have this unprecedented crisis and this unprecedented data collected on the crisis so that we can study what happens to people in weekly or biweekly increments and see how these policies affect people in real time with a lot more power than we would typically be able to do when the unemployment crisis is happening, but for individual families that we may not detect in the data. So just to set the stage for the inequities that we have in the United States and how that shaped the inequities that we've seen during the pandemic. This is the average or the median wealth of families in 2019 by race and ethnicity. And what we see is that Black families have about 1/8 the wealth of white families, and Hispanic families have about 1/6 the wealth of white families. Now, these disparities, like all disparities, are not inevitable. They are shaped by historical policies like slavery and redlining, and how that affects the inheritance that babies born today receive. Also shaped by modern day policies like a low federal minimum wage that really keeps people from having enough money to survive on. When the pandemic hit, this really affected whether people had a safety net, whether they needed to, whether they would immediately face food and housing insecurity if they lost their jobs, and whether they needed to keep working in jobs that would have had high exposure to COVID. So that shapes a lot of what we see with both economic precarity and the spread of COVID-19. We have seen that prior disasters have exacerbated disparities in this context. There's important research from the Great Recession and seeing that it took much longer for Black and Asian households to recover. Even 10 years later, they hadn't fully recovered from the Great Recession, partly because there was just less of that safety net, less wealth to fall back on. We see that prior diseases like the HIV pandemic really disproportionately affect people who are Black and Hispanic relative to white. Again, these disparities are not inevitable, but are shaped by this structural context. And white men who have sex with men have a 1 in 11 chance of getting HIV in their lifetimes, where that has been 1 in 2 for Black men who have sex with men. And you know, I think we can rethink how do we structure our society so that we reduce some of these inequities, so that we really help support people who are most at risk of infectious diseases, most at risk of food and housing insecurity. And that's what I hope you'll take from today is the impetus to go do some of that research and think about what we can learn from this moment. Similarly, we see that climate disasters like hurricanes and Hurricane Katrina really have had disproportionate effects on Black and Hispanic populations relative to white populations because of a combination of the existing disparities and policies that layer more structural inequities on top of that. The COVID pandemic has some good news and some bad news on policies that can make a difference. But from the good news, what I hope we learn is that policy leadership on countering inequities can successfully counter them. And I hope that encourages us to aspire to informing policies that can do that routinely in an enduring way and also in response to future crises. This is how the economic crisis played out, and I'm so grateful for this journalism, which shaped a lot of the work that we did and how we chose to design the COVID-19 US state policy database, which was really to focus on low-income populations and the need for economic supports for low-income populations. So this figure depicts the job loss that occurred in prior recessions in 1990, 2001, and 2008 for high-income populations in green and for low-income populations in purple. And you can see that the COVID crisis was far worse than any prior recession, that high-income households recovered quickly. Most people were able to work from home. Low-income households had a steep decline and a slow recovery and really needed the economic supports that fortunately were provided through policies. Again, to expand on how the existing structural racism and structural inequities have shaped disparities during the pandemic. Looking at the full population actually obscures the full extent of disparities. Dr. Mary Bassett, who is now the New York Health Commissioner, did seminal work describing disparities in mortality by age group. And this is important because structural racism has actually shaped a context in which Black people die much younger than white people already. And so if we look at the full population, there's a lot more of the population that is white that is living to 75, 85, 95. And of course, they have high death rates from COVID. But when you look at who's dying young, who's dying under age 65, it's also important to standardize it by age. And then we see that the disparities are up to 14 times as high for people who are Native American. And of course, now we have the most recent data on life expectancy showing that there were large declines in life expectancy in 2020 that unlike other high-income countries, the United States continued to experience further declines in life expectancy in 2021, and that those have been especially severe declines in life expectancy for people who are Black, Hispanic, and Native American. And like all disparities, these are not inevitable. They are shaped by structures and by modern day policies. And we can implement policies that reduce these disparities. I'm really glad that the CDC COVID tracker has recently added data on COVID-19 deaths that are age group specific. So again, talking about dying young, these are people aged 50 to 64. Many of them are likely caregivers for children. And what you can see here, this depicts trends over time. We don't have the total numbers presented by the CDC, but what we can see here is that these yellow and green lines and orange lines later are at the top, right? And those are Native American people, Hispanic people, and Black people who have been dying at elevated rates at younger ages throughout the pandemic. So knowing that that policy response that was evidence-based, that was equity-oriented, would be important for responding to the COVID-19 pandemic, we created the COVID-19 US state policy database. And we have tracked several COVID prevention policies, the vaccine distribution phases, the phase 1, 2, 3, but also the timeline, when did vaccines open up to different populations. These policies were very important for shaping, whether essential workers who did have very high exposure to COVID at their workplaces, who were also those populations that were more likely to die young, to be caregivers. Did they receive vaccines? And how equitable was that vaccine distribution? What can we learn from that? Well, we have a lot to learn from that, not just for COVID and the continued delivery of boosters, which has actually been even more inequitable, and new boosters, which are even more inequitable, and now they're going to no longer be free. We also need to learn from that for flu and polio and other vaccines. So I hope those data will be useful for that. We have the initial state of emergency declarations, and some of these policies we've sort of sunsetted tracking because they stopped being as relevant for policies. But if there's a policy that you would like to study, such as the end of states of emergency, then we would love to work together to track that and provide it as a public good, so that you and your team can use the data, we can help validate it, and many more researchers can use the same data. Stay-at-home orders. There was a lot of research using these early on. Closures and reopenings of businesses, face mask policies, and then the post-June 2021 face mask policies, which we actually don't have a lot of research on, so that would be an important domain of research as well. Interstate travel quarantines, alcohol and firearms policies. One interesting public health point that we saw emerge in those data was that during business closures and as the population was experiencing this spike in mental distress that we saw in the data, that alcohol stores and firearm stores were open. They were considered essential businesses. I think this is important to study for how did that affect deaths of despair, diseases of despair, at this time of crisis. Vote by mail, tracking that, especially in the earlier period of the pandemic, and policies pertaining to people who are incarcerated. Then in terms of economic precarity, we have several data points on unemployment insurance. Research fellow Will Raderman really led this effort to track unemployment insurance and to track all aspects of it, like what are the eligibility thresholds for receiving unemployment insurance, because people are actually excluded from unemployment insurance if they earn too little. Only 25% of people receive unemployment insurance. without the federal expansions of people who lose work receive unemployment insurance without the federal expansion. So, so this is an important policy to study. How does unemployment insurance affect people and their food insufficiency and housing insecurity and longer term health trajectory, and how might we strengthen the existing unemployment insurance system, because we learn how insufficient it is from these crises. We have more monetary eligibility thresholds here on unemployment insurance policies specifically to improve food security, like pandemic EBT, and providing food for kids who were not in school, and housing policies, which is one of our strongest domains, thanks to partnership with Emily Benfer and the Eviction Lab. The Eviction Lab is really designed by lawyers and tracks a lot of detailed information. We have tried to design it for public health and population and economics researchers who can use the date that eviction policies were implemented and ended to study how that shaped health and economic hardship and well-being. And then on health inequity, we have data on workplace protections by state, on state minimum wage, on healthcare delivery, on whether states were tracking racial disparities, and on populations with substance use disorder. To show you what the data look like, if you go to our website, statepolicies.com, let me put this in here. If you go to the website, it's really designed for you to be able to start working with the data today and merge the data really easily. So this is the example of face mask mandate after June 2021. We provide the date of last review here. If you see that it's out of date and you want us to update it, send us an email and we can work together to do that. And then when you download the CSV file, you'll get this table, but you'll also have the state abbreviation and the state FIPS code. We really want you to be able to just easily merge it with your data set and get to work looking at what happens before and after states implement, for instance, a face mask mandate after June 2021. All right, so just to give you some quick examples and then kind of go into some more detailed examples of how we've used the data. We were really excited to see several researchers run toward the COVID prevention data, especially this really important study by Liu and Webby that is published in Health Affairs and indicates what happens to the spread of COVID when states implemented mask policies compared to over time in states that didn't implement mask policies. This is an event study design, which is an extension of the difference in differences specification, which is looking at how trends change before and after in a state that implements a policy compared to a state that doesn't, or several states that implement a policy compared to several states that don't. We see with mask policies here, like being able to use the event study specification is nice because we can see both that there were no differences in trends in the spread of COVID before state implemented mask policies, but then after states implemented mask policies, then there was this reduction in the spread of COVID that started immediately and then increased over time because the cases that were averted didn't turn into several more cases and chains of transmission. This is another study led by John Jay from the Boston University School of Public Health on physical distancing policies. And in this study, really looked at physical distancing by income. We didn't find that there were differences in the impact of policies, physical distancing policies by income. I think largely because we saw people really stay home for themselves. We saw a lot of people stop going to work before the policies were even implemented. And I think a lot of businesses closed before the policies were even implemented. And I think following the policies closely over the pandemic, I think it's important to remember that in this period, New York was shut down, and all that there was the sound of sirens in the street, and there were they had to bring in additional morgues, and it was quite a disaster scenario. And so it was logical for individuals to stay home. It was logical for the government to help people stay home, and to help people stay home by providing financial support through the stimulus bill as well, and expanding unemployment insurance, while we learned more about how the virus spread. Now, there's a lot to be said about how we could have proceeded with a rational policy approach, equity-oriented policy approach, after we learned how the virus spread. This study came out relatively early on in the summer of 2020. But I think that probably is one of our biggest domains of learning, is how do we strengthen government institutions and their ability to speak to policy evidence, as well as the evidence on individuals. I see a question. Oh, great question. Thank you. In the policy database, are there links to the original sources for the data? Yes, we've done that partly so that you can also come up with your own coding scheme. So we have on the website a Dropbox that has a screenshot. Sometimes it was just a government website that would announce school closures, and of course, that's long gone. So it ended up being very useful that we tracked this in real time. And we provided the screenshots so that you can verify the information, you can cross-check it. We always recommend with any policy study that you do, we always recommend triangulating the data with other data sources, making sure they check out, understanding why discrepancies occur, and if that informs your coding decisions. And we've also provided the executive orders. So for instance, we list the date of implementation. So if there was a stay-at-home order announced on a Friday to be implemented on a Monday, then we list Monday. But you might want to list Friday because maybe that announcement really prompted people to stay home. And so we have the screenshots of the executive orders that you can look at there. And the executive orders are very interesting from a qualitative perspective because their language differs dramatically from, COVID is not a big deal, but, we're taking a small step to address it, to, we are have a public health emergency and we're implementing a stay-home order. So it's interesting from the politics and power and partisanship perspective as well. This is another example. This is a working paper where we use the minimum wage data to do a more descriptive study. There were not big enough changes in the minimum wage to really be able to look at how the changes in minimum wage affected people's food insufficiency and housing insecurity. But we did look at state minimum wage and how that shaped food insufficiency during the pandemic, and did see that higher minimum wage was associated with reductions in food insufficiency. And maybe I'll pause a minute for any questions on these, and then I might just describe one study that gets more into the specifics of policy to make sure we have time for questions. But are there any questions right now before I kind of describe these in detail?
I do see one question. It says,
Great.
In this policy database, are there links to the original sources for these dates?
Yes, yeah, so that was that's the Dropbox that has all of the executive orders and screenshots.
Great.
I think also part of the mission of the database is to just, we've seen so many amazing dissertations, like where someone tracked down the data for their state on a social policy like evictions or like SNAP. And we think those papers are really important and we want to see more of them. I think social policies do so much to shape health. And so part of the point of this database is to allow this largely unexplored topic in the public health field to be much more fully explored. Most of the papers on minimum wage are from economists and are focused on employment. But what about minimum wage and food insufficiency and housing insecurity and health? We have a few papers on minimum wage and suicide, but it would be important to see papers on minimum wage and homicide, minimum wage, and all kinds of health conditions, especially those that disproportionately affect people who are Black and Hispanic and Native American, who are more likely to receive the minimum wage. Oh, good. I see more questions. Let's see. Are the policies always consistent at the state level, or how do you deal with heterogeneity within states? Yes, so we only track state policies, and we actually set a high bar for saying, it needed to be a requirement rather than a recommendation. Probably we all have some experience with recommendations at this point, not holding a lot of, doing a lot to help support people so much. The requirements really make a big difference. And we have a data dictionary that specifies how we've defined each variable. And so, a lot of it is just setting parameters for how we measured policies and how we defined them. For instance, we defined mask policies. It was only mask policies that covered everyone, not just mask policies that covered people who were not vaccinated. Again, I've not really seen those work out well in practice. And so that's how we decided to code them. Now, you could decide to code them differently. And study, for instance, mask policies for people who were unvaccinated, as well as mask policies for everyone. That's why we provide the source data so that you can see it. Are there CUS data sets that look at urbanicity and rurality aspects of health disparities during the pandemic? I think the best way to do this is to look at to pair the COVID, the CUS data, the COVID state policy data, with data that are by urbanicity. So you could look at COVID, like the county trackers of COVID, right? So you could look, I think this is a very important question I haven't seen anyone explore, right? So, how did mask policies affect people in urban areas versus people in rural areas? And to look at whether the counties are rural or urban and stratify in that way. I think that would be a great analysis. So I think there's a lot more work to do, and a million questions that are possible with these policy data. I think the way we have thought a lot about it in this fast-moving policy period is just what's most important for population health. What policies are most likely to be most impactful for people, most impactful for equity. And where has there not been a lot of research? So, I think mask policies are very important. I've done a lot of communicating about them. I haven't actually led the research on them because we have several good event studies, several good lab studies from aerosol scientists showing that universal masking makes a difference. And it wasn't really a matter of evidence. There were other forces at play in that discussion. I think there is still a lot of work to do on trade-offs as well, right? Like certainly there's a cost to wearing a mask. There's a cost to implementing a mask policy. There's also a cost to not implementing a mask policy that happens at a different time point, right? And so, and those costs may include many costs, right? Like if you don't implement a mask policy and you have more COVID, your hospitals may be more overwhelmed. You may have more people out of work and labor supply issues. You may have more kids growing up without parents, and like those are some very high costs. I think that's a lot of the work that we have to do is to lay out some frameworks for weighing those costs and benefits, and speaking to the difference between policies and individual level actions. So it can be completely rational from a policy perspective for an individual to say, I do not want to wear a mask. I'm at low risk. My family's at low risk. And I really value seeing my face and connecting with people in that way. That's super valid for that individual to make that decision. It also doesn't just have implications for them. If they have COVID and spread it to 15 people at an event, those are a lot of costs for those other people. Some of those people might be high risk. Some of those people might be low income and miss their paycheck because of getting COVID that week. Their family may not have enough to eat. So we have to weigh the costs. We really look to leaders to weigh the costs in a way that looks out for the whole population, and that especially looks out for the populations that have been historically marginalized by historical and modern day policies. And that's a lot of the work that we have to do and learning we have to do from the pandemic too. But I hope that that we can inform that by documenting what has happened in the policy space, what has happened to equity, and what we can do better going forward. Okay, great. All right, 7 minutes to close out, including questions. Thank you. Okay, so maybe what I'll do is I'll talk about our eviction paper. So this is about unemployment insurance. My slides are on the website, so you can feel free to look at those slides to learn more about the unemployment insurance work. This study more directly relies on data from the policy database. So this takes advantage of, this is studying eviction moratoriums and spread of COVID-19 and COVID-19 deaths. Again, this is thinking what policies are most important for people's lives in this moment, what evidence will be most important to inform policymakers. And so Kate Leifheit, who led this study, we connected early in the pandemic, and we knew that these eviction moratorium policies would be very important for people. We knew it was important for the CDC to have information on how these policies affected the spread of COVID. And this the study ended up being able to inform the CDC Eviction Moratorium. We put it out as a preprint, and it was really the main study providing the rationale for the moratorium and helping it withstand several legal cases. So really appreciate Dr. Leifheit's leadership on it. She's at UCLA now, and a great person to connect with for anyone interested in social policies who's on the West Coast. All right, so just to make this brief, since we only have a few minutes, there were these large disparities in who was falling behind on rent in the pandemic. 30% of Black people were falling behind on rent, 8% of white people, 21% and 18% of Asian and Latino people. So really large disparities. In all cases, the economic hardship disproportionately affected households with kids. And this is very bad. There was a daily episode on a child trying to learn in the pandemic. He had been served his mother's eviction notice because she had lost work during the pandemic. She was out looking for work. And every time the mail person knocked on the door, this poor child would just freak out because he thought that someone was coming to kick him out of his house forever. And that was not a context in which he could learn or thrive. And that is the kind of context that we can help people avoid in an enduring way with stronger policies. So again, housing policy is an important domain of research. These are the co-authors on the study. I'm so grateful to have worked with this team, and again to Kate for leading this study. Okay, so the study design was all states that ever instituted a moratorium. States entered when the moratorium was first effective, and we actually looked at what happened when the moratorium ended. Everything was so volatile at the beginning of the pandemic. There were so many policy changes. It was really hard to tease out what role did eviction moratoriums play. So that's why we really chose to focus on when they ended, and the things were a little bit more steady state, and we could really study, how that affected things. We again did an event study. The exposure was the time since the moratorium was lifted. The outcomes were COVID-19 cases and deaths. Covariates were testing rates and other public health interventions. And we had fixed effects for each time and state. Just to go briefly, these are the states that had a moratorium throughout the study period. These are the states that lifted their moratorium before the CDC eviction moratorium was implemented. and then states that never implemented that were excluded from the study. This is the timeline of when states ended their moratoriums. So more than half had ended by the time the CDC moratorium was implemented. And this is the event study looking at the spread of COVID-19 in an event study, again, looking at, this is a negative binomial model, again, looking at these similar trends leading up to the moratorium and then an increase in incidence. We especially saw increases in deaths after moratoriums were lifted, likely because the moratoriums most affected people most who were at high risk of severe disease or who then had to go back into unsafe work environments. The moratoriums were associated with several excess cases and excess deaths relative to the states that maintained their moratoriums. So lifting the moratoriums was associated with that. And this was ultimately extended past June 2021, but ended in the fall of 2021. But this is important to learn from. Should we implement an eviction moratorium every time there is an economic crisis because of all of the ramifications of evictions for families and their credit, and having it really sets a family back in looking for a job, in having stability and well-being for a long time if they are evicted, and can we avoid that by implementing moratoriums during periods when evictions are likely to surge. And then a couple of additional, oh yeah, please contact me directly, also on Twitter at Julia Raifman. And this is just to prompt some further research. We did some description of who is missing work without paid leave in an Urban Institute report. Low-income people are 4 times more likely to miss work without paid leave during the pandemic. Many people report food insufficiency when they miss work without paid leave. And can we study how state paid leave policies are affecting that coverage? And also, are they reaching the lowest income people? One of the trends we saw from tracking so many policies was that people are excluded again and again. Lowest income people are excluded from paid leave if they work too few hours to be counted. Minimum wage exclusions for tipped workers, unemployment insurance exclusion for earning too little, and healthcare exclusion, right? People who are not covered by health insurance. So we see this trend again and again, and can we study the people who are excluded from policies and how that's affecting them, and how we might make policy coverage more comprehensive?
Okay, I hope that was a good stopping point.
Yes, thank you.
We have to wrap up, unfortunately, but as we have posted in the chats, please feel free to reach out to Dr. Raifman at the email and Twitter that we have posted in the chat. And there's another slide up for those who might just be listening to thank the team. Do you want to say one last thing before I close us out?
No, I hope this is useful to you all. I hope you keep running with it. We've seen that policies can make a big difference for people, and can we document some of those policy supports and how we might bring them to more people, especially the people who are most likely to need them.
Thank you so much, Dr. Raifman. And thank you to everyone who joined us. That is the end of this webinar. The recording will be available shortly on the ICPSR YouTube channel. Thank you, everyone. Take care.
Thank you.